So I'm Ray Dolan, professor of medicine at Harvard Medical School, Beth Israel Deaconess Medical Center, and Brigham and Women's Hospital in Boston.
I'm John Bennett, but everyone calls me Jack, so I'll say Jack Bennett, and I'm the head of the clinical mycology section at NIH in Bethesda, Maryland, but I'm also the associate program director for the clinical training program in infectious disease at NIH, and I've been training infectious disease fellows for several decades now.
I'm Martin Blazer. I'm the George and Muriel Singer Professor of Medicine at New York University School of Medicine and Professor of Microbiology and Director of the Human Microbiome Program at NYU.
So our book is a very broad discussion and presentation of material with respect to infectious diseases that will address new ways to diagnose, new ways to treat, and new ways to provide overall recognition and control for infectious diseases. And this is a very exciting area because important advances have been made in multiple areas of infectious disease, which our book addresses very directly.
Wouldn't you agree, Ray, that one of the challenges now for clinicians is a constraint on time? Physicians need information and they need it right now, and so one of the challenges for PPID has been to make that information readily accessible. We've done that with the short view summary.
One can easily look up how to treat a problem in many different ways. But the strength of PPID is that we're trying to provide a comprehensive view of context so that physicians can individualize the care of their patients so that they can understand the importance of the nuance and optimize therapy.
I think there are a number of very exciting aspects, but the ability to present critical information that encompasses such a broad variety of topics and has such wide application to treatment of disease is very exciting. Our book has a number of very unique aspects. Perhaps the one that we're most proud of is the fact that each of the authors of a chapter is a recognized authority in the field, and that the presentation of material in each chapter throughout the book has been very carefully reviewed and edited by all three of us, so that this really does represent a very authoritative text with which to address these many important problems. Well, I think that our intent was really to make this available and accessible to a very broad audience, including individuals early in their training, experienced clinicians, a variety of healthcare providers, pharmacists, for example, and individuals involved in healthcare in a very broad variety of aspects. And we think the book will be very useful to all of these individuals.
One of the advantages of PPID, our textbook, is that you can access it from a different point of view. For example, if you're interested in treating immunocompromised patients or patients who are burned or post-operative, or you're interested in infection control, there are chapters that address these. So there's different, so we're writing for different audiences all within the same textbook.
We live in a world of microbes, and the goal of the infectious disease practitioner is to guide us through those interactions to maximize health. Of all the fields of medicine, infectious disease is the most ecological, and I'm hoping that as the years go by, the practice of infectious disease becomes more and more ecological, and that will, we hope, shape many other practices in medicine.